Hello and a very warm welcome to Network 18 and Electral present Hydration for Health, where we are going to look at diarrheal dehydration, causes, interventions, and precautions. I'm Mugdha Kalra. More than 1 lakh children under the age of 5 years die of diarrhea in every year in our country. Let us try and get a 360 view of this issue and get some expert insight into interventions. Joining me on this special panel, Dr. Virendra Mittal, consulting pediatrician, pediatrics and neonatology, Dr. Surendra Singh Bisht, MD Pediatrics, DNB Pediatrics, Fellow Neonatology, AIMS and Specialist Department of Pediatrics, Swami Dayanand Hospital, and Dr. Amit Adhikari, MBBS, MD Pediatrics, CCI PPGP and Boston University, child specialist and consultant neonatologist. Dr. Mittal, let me start with you. Diarrhea is a very known problem, and yet it is not taken very seriously. What is actually diarrheal dehydration if we were to look at the symptoms?
So actually, diarrheal dehydration is the basically imbalance of the our body fluid between the intake and the output. So if input is less and the output in the form of diarrhea is more, so there is the negative balance of the body fluid in the body, and it leads to dehydration. And dehydration is the basic cause of the or morbidity and mortality in the diarrhea. So it is the bouts of diarrhea and output of the fluid from the body more diarrheal losses than the intake of the fluid in the body.
Dr. Bisht, when we talk about diarrheal dehydration in a country like ours, what are some of the things that you see and why is it so prevalent here?
Diarrhea is prevalent in our country. So it will be in other countries as well. There are so many countries where it is there. In our country, we have an overpopulation. India is going to become the most populous country by in another few decades. So, and यहाँ पे हमारे जो जीवन के स्तर हैं, the living standards are such that we do not get the kind of water which we should get. There is population, there is infection, and the agent host environment. जो एक डिजीज के लिए तीन चीज चाहिए होते हैं, एजेंट होस्ट. तो बैक्टीरिया होते हैं, होस्ट एक ससेप्टेबल पॉपुलेशन है हमारे देश के अंदर. छोटे बच्चे हैं, बड़े हैं, और एनवायरनमेंट इस तरह का है जहाँ पे इन्फेक्शन हो जाते हैं. So we have all that ingredients which make infections very common, and diarrhea is common.
Dr. Adhikari, if I may put the next question to you, what are the significant causes of diarrheal dehydration?
Actually, in our country, mainly it is infective. Infective diarrhea is the most significant cause of dehydration throughout the world, especially in our country, whether it is bacterial or viral.
What can be the cause, Dr. Adhikari, when we are talking about, say, a young child? What could be the possible cause? Drinking water, of course, is one. Are there more causes to that?
Actually, when there is diarrhea, it may or may not be associated with dehydration, but there are two factors. If a child is drinking less during diarrhea, or there is more water loss uh, in the episodes of diarrhea, then the dehydration sets in. So, two reasons: less intake or increased output.
Dr. Mittal, is there a high risk group that is more susceptible to the illness? Of course, we know children, but other than them, are there more people involved in the high risk group category, or mostly it is the numbers are much larger when we look at children?
Yeah, so basically, diarrhea can occur to anyone, but the high risk pediatric age group is definitely high risk than the adult because they have a uh, more body mass index, they have a lesser age, and high metabolic rates, or there are a lot of chances of the malnutrition in the children's. So with the children's with the chronic illnesses like celiac disease, uh, pneumonias. So these are the high risk children who can get diarrheal infection. So that these are the high risk children. and they get more suffered with the diarrhea.
And what
Yeah.
would be the other groups that come close after children?
Other than the children, whosoever is suffered with the diarrhea may can go in the diarrheal dehydration. But the high risk group, definitely children are in the high risk group because they have a low body volume, so they are in the high risk group.
Right, sir. Dr. Bisht, if we look at some of the signs and symptoms of diarrheal dehydration, do we see them vary from age group to age group?
What are the high risk groups which can get affected other than the children? Children, we are concerned because it is still a major cause of mortality, deaths in under 5 children, and diarrhea is a simply preventable cause of death. So we need to look into that. This is what Dr. Mithil was was telling. And apart from this, the elderlies, the those who are under any chemotherapeutic agents, those who are suffering from malnutrition in adulthood, some chronic gastrointestinal disease, liver disorder, the pregnant ladies have a double, they are in double jeopardy. So because they don't even suffer, they are going to suffer from diarrhea, and they have an issue about the fetus which is growing inside, and it may lead to intrauterine death as well. So these are the high risk groups. Whereas the sign and symptoms is concerned, तो क्या लक्षण होंगे जो बच्चों में या किसी भी व्यक्ति में हो सकते हैं, वो लक्षण है dehydration ke, your thirstiness is there. They do not pass that urine that often. There is eyes get sunken, especially in malnourished children. Their skin turgor is low. There is an alteration of sensorium. थकान होती है, घबराहट होती है, palpitation हो सकते हैं, और these are things which are symptoms which are seen in children. Obviously, ultimately, the patients can go in shock and death. These are the symptoms which are usually seen in all age groups, but in children, because as said, they have a different kind of a body mass index compared to adults. They go in dehydration faster.
Dr. Adhikari, you wanted to add to that question.
Actually, what Dr. Surinder Singh did say, I want to add some points that malnutrition is a major cause of diarrheal dehydration more profoundly. So, in any age group, it may be in child, it may be in elderly, it may be in all other age groups. इन लोगों को छोड़ के the people actually who have immunodeficiency diseases like AIDS and who are suffering from cancer, definitely they had the chance of diarrheal dehydration much more. So they are in the high risk group.
Dr. Adhikari, what are some of the complications that arise due to diarrheal dehydration?
The complications are some mild complications and there are some severe complications. In case of mild complications, there are lethargy, uh, there may be electrolyte disbalance. Electrolyte disbalance is a major short-time complications, and the major complications are apathy, like the loss of consciousness, and so also death.
Dr. Bisht, what are the complications that arise due to diarrheal dehydration?
The complications, ultimate complication is death. So apart from this, there can be kidney failure. There can be obviously in severe malnutrition, as I said, malnutrition is there. This electrolytemia, alteration sensorium, convulsions, yes, and all that can lead to death in dehydration. There can be multi-organ failure as part of diarrhea, dehydration, shock, leading to an irreversible condition, which can lead to death. So these are important conditions which can be preventable. So people should not take diarrhea lightly. Diarrhea should be taken care of with that kind of seriousness. That is why I think the whole program today is so that people know how to prevent diarrhea, and in case diarrhea has happened, so how to treat it efficiently early before it actually spirals down to irreversible stage.
Correct. Correct. Dr. Mittal, how does vomiting affect a person with diarrheal dehydration?
So definitely, dehydration is the major crux of the diarrhea. And if the child is suffered with the vomiting, then there is a chances of the double loss of the fluid from the body. It is going in the vomiting, it is going in the stool, as well as because in the vomiting there is the loss of the fluid, which is the more important, as it is enriched with the potassium and the sodium. So there is the double diselectrolyte disturbance. There is a double chances of the electrolyte disturbance because the our salt means sodium and potassium is going out from the diarrhea as well as from the vomiting. So there are a lot of chances of this electrolyte disturbance are there. So vomiting can enhance the complications of the dehydration.
Dr. Bish, at what stage does it become extremely necessary to see a doctor in case of diarrheal dehydration?
So, very good question. In fact, not all diarrhea should come to OPDs and should flood our hospitals and our OPD outpatient department. So for even with the first kind of a loose stool, they should not rush to a hospital. This is we don't want people to panic. So this is the right question, and people can do something to see how what is the purge rate. Purge rate means the number of stools passed in certain time. So if the purge rate is certainly more than the kind of rehydration you are doing. So if the child is able to take only 200 ml and you know the child has passed stools which is 3 or 4 times which are large volume stools, so this is something this child uh, body fluid losses have not been met by the oral solution which you are whatever you are giving at home. You know this child, and plus as Dr. Mittal said, the child has started vomiting as well. So there's nothing which you can, whatever you are trying to give, the child is vomiting, so there is no way you are able to replenish what the loss is. So in that situation there is a need for intravenous fluid administration. So in that case, certainly hospitalization would be required. But I must say this doesn't happen very often. So you people don't need to rush to कि हमें glucose bottle लगा दो और इसको 3 दस्त हो गए इसको glucose लगा दो, which is become so common in villages and all small places. No, it is not required. It is not required that often. But as you asked, if the purge rate is so high, or if the child or the adult is vomiting so much that there is no way fluid can be replaced orally, then probably they need to come to us. And obviously, the alteration of sensorium, kidney failure, not passing urine, that all are situation complications we have already.
Right. Dr. Adhikari, in this fast moving, ever changing lives we have, we often neglect small things that matter the most. Tell us then, how can one reduce the risk of dehydral dehydration?
Start to take the what is WHO what is, then he or she can surely prevent the diarrheal dehydration or the complications associated with it.
Dr. Mittal, how do we treat, cure, and manage diarrheal dehydration?
Our aim is to treat the diarrhea. So the plan of the management in the diarrhea based upon uh, the severity of the dehydration. Is there no dehydration? There is some dehydration. There is severe dehydration. If the patient has loose motions, but the dehydration is not much, in that case we can have a plan A. We can manage the child at home with the sips of water, with the sips of water mixed with the salt and sugar, with some homemade food like bran, lassi, khichdi, dalia. We can manage the child with this at home. Or if the child is going to have more loose motion, then we can add ORS solution, oral rehydration salt solution, or the oral rehydration therapy. If the child has if the child is not improved with this plan, or the child is going in the dehydration, in that case we have a fixed quantity of ORS that we can give to the patient. The parents can give that quantity of the ORS in case of dehydration, like it should be given in the range of 70 ml per kg. If the child has 10 kg weight, then we should give 700 ml of the ORS in the 4 hours of duration, so that we can manage by this we can replenish this dehydration part. Or and after that we can give maintenance therapy. If the child is going lose motion, we can replace loose motions by the ORS. If the child is going 10 ml per kg. If the child has one episode of the loose motion, we can give 100 ml ORS in that of condition. And finally, the maintenance therapy. If after that child is not improving and going in the severe dehydration, then we should rush to the hospital and we should manage the child with the IV fluid. So there are a set protocol for the IV fluid. In that case, we can definitely manage with the IV fluid. So if the child have a mild dehydration or no dehydration, we can manage by the plan A and the plan B. And if child has severe dehydration, then definitely we go to the hospital for the IV fluid.
Right, Dr. Bish, I should have asked you this question before, but for to explain it to layman, what is oral rehydration, and are there any stigmas or myths around it?
What is oral rehydration? Oral rehydration. So this is trying to replenish, trying to fill the gap which has happened in because of diarrhea by giving some oral therapy. So what was given earlier, as Dr. Mittal earlier said, are things which are home-based fluids which are to be given. And I must say, Mugda, that if there is one discovery or invention in this world so far which has saved the most of lives, then ORS stands number one. So the number of lives saved by oral rehydration salt solution is the highest. So it composed of it has sodium chloride, it has potassium chloride, it has dextrose in some form, glucose in some form, and it has citrate. So these are four elements of oral rehydration salt solution. Why it is given? Because giving plain water doesn't need it doesn't lead to replenishment of water. It doesn't get absorbed through the intestinal epithelium. जो intestinal lining होती है वहां से absorb नहीं होता है खाली पानी. So it requires salt, sugar and salt combination, which the both molecules, one acts as a carrier for another, and that gets absorbed and that goes inside the body. It gets absorbed and goes into the blood to replenish the intravascular volume, which is the total volume which we need to pump our heart. So all these fluids are required to maintain our intravascular volume so that our body does not go in shock. So this ORS solution is the combination of those salts. As Dr. Adhikari said, it has sodium. The value of sodium. So what was the sodium when we had cholera era? And those era, the ORS solution was something different. And obviously, it had very high sodium because in cholera, a lot of sodium used to get lost. So in that, now that we don't have that kind of a cholera, we don't have that diarrhea, the complications which the last ORS, the old ORS did was leading to hypernatremia. It used to lead to increase in sodium in the children or adults, which led to some electrolyte disturbance, some alteration of sensorium, in fact, seizure as well, and some dehydration difficulty. So that hypernatremia was one of the complications. So that was the only myth why people was not little scared of giving ORS. Another thing was the taste. It was more salty. Now with this newer or smaller new ORS which is now available with us, that the new Electral which you are giving right now, we are giving right now, is the Electral which is better to the taste and palate of the children and adults.
Right. Dr. Adhikari, when should one use ORS? Should it be used as soon as a case of diarrheal dehydration is diagnosed? And mostly it is diagnosed at home. When should somebody at home give ORS? At what stage? And if you could tell me again about the recommended dosages for different age groups.
Actually, what is such an important thing? It should be started from the beginning. Uh, when a man or woman or a child is suffering from diarrhea, he or she should take waters just from the beginning. This will save his or her life in many ground. So, no antibiotics, no other things are needed except the waters to prevent the diarrheal dehydration.
We should definitely use the ORS in the beginning of the diarrhea. but the dose is definitely different for the. It depends on the severity of the diarrhea. It is in the mild category, moderate category, or in the severe dehydration. But we should never stop the ORS solution. Uh, Even we are going to the hospital, ORS solution we should give till we are going to the hospital. So the doses of the ORS, as I mentioned in the previous question, previous answer, that the if the patient is in the case of dehydration, we should give total dose of the ORS is 70 ml per kg in 4 hours. This is the it is the to replenish the dehydration. After that, we should give ongoing losses. We should replace the ongoing losses, and the dose of the ORS in that case is 5 to 10 ml per kg per stool, and after that it is the maintenance dose. So this is the total dose of the ORS. It is total about the dosage of ORS.
I would just like to take a round of final comments from you, doctors. Dr. Dikari, you may go first. What would your advice to parents would be when it comes to diarrheal dehydration?
माय एडवाइस टू द पेरेंट्स इज, देखिए जब आपको लगे कि डायरिया शुरू हो रहा है कोई बच्चे में, तो फर्स्ट से वायरस स्टार्ट कीजिए एंड देखिए कि उसमें नंबर ऑफ स्टूल्स कैसे होता है, उसके साथ ब्लड है या नहीं स्टूल में, चाइल्ड डेफिनेटली धीरे धीरे लेथर्जिक हो रहा है या नहीं। आपको जब लगे कि ना नंबर ऑफ स्टूल्स बढ़ रहा है या चाइल्ड इज गोइंग टू बी लेथर्जिक, definitely and other complications like pain abdomen or vomiting is increasing, the child cannot take the waters properly due to the vomiting. There are some kind of things which the parents should monitor in home, and if this happen, then they definitely should go to a doctor.
Final comments from you, Dr. Mittal, on advice you would want to give parents who may be dealing with this at home?
We should not give only sugar to the child, because the most of the parents, I have seen a lot of the patients, those taking the fluid mixed with the glucon D. So it is the totally dangerous. Glucon D alone is the glucon D or the solution only mixed with the sugar is dangerous in the diarrhea. It should be mixed with the sugar and the salt. Same, we should advise to the parents that the ORS they are mixing in the water, it should be in the proper quantity, because I have seen a lot of patients with the hypernatremic dehydration, because they put a ORS packet in 1 glass of water that should be dissolved in the 1 liter of water. So I have seen the case of the hypernatremic dehydration. We should advise the parents that they should mix the ORS packet in the desired volume of the water, because there are two types of the ORS packets in the market. One should be dissolved in the 200 ml of water, and one should dissolve in the 1 liter of the water. Few parents are what are they are doing? They are dissolving the packet of 1 liter of water in 1 glass of water. So there are chances of the hypernatremic dehydration. And few parents are what they are doing, they are dissolving the packet of 200 ml of water in the 1 liter of water. So there is chances of the hyponatremic dehydration, because they are giving diluted amount of the ORS. So first and foremost important guideline to the parent, that they should mix the ORS in a proper quantity of the water. So this is the very important advice. Being a doctor, we should check what they take, which type of the packet they buy in the market.
Dr. Vish, final comments from you. Definitely would want to know, not just for the parents, but what kind of precautions should one keep in mind if they are in the high risk category, other than children as well?
For high risk like malnourished children, this ORS needs to be modified. So this is a different kind of a rhizomol ORS which needs to be made. So for severely malnourished children, which I think we see only in a public hospital only, so they need to be given some different kind of ORS. So that we should know when to get. And other as such for parents, for athlete, for runners, I take ORS as often as possible to prevent dehydration, from preventing those conditions for pregnant ladies in diarrhea, in fever, in heat stroke. Certainly, giving ORS helps. In dengue, ORS helps. In any viral fever, ORS helps. So, giving in all those situations where there is a in kind of a COVID situation, also we were saying when fever was there, give ORS, give fever and antibiotics and ORS. So, in any febrile conditions where there is a likelihood of dehydration by perspiration and all that, you must give ORS when there is a lack of things. So there are conditions where it can be given in elderly as well, because they are likely to go into hyponatremia very often. We see our elderly, so giving ORS helps in that situation. In a diabetic person who is otherwise getting hypoglycemic because of anything else, giving ORS certainly helps. There also. Not for other reasons. In others, it is for diarrhea in diabetes contraindicated, but a diabetic who goes into hypoglycemia, giving ORS helps.
Well, thank you so much, Dr. Adhikari, Dr. Mittal, Dr. Bisht, for these insights. Even though it seems to most of us that diarrhea is harmless, but it is important to watch symptoms and manifestation in case of babies, toddlers, people with weakened immune systems, and elderly people. And timely medical advice and hydration can be the key to reducing complications of severity of not just diarrhea, dehydration alone, but lot of other ailments, as Dr. Bisht just mentioned. Thank you so much for giving us your time. And thank you so much, audience, for watching.